Have you ever had an itch that just wouldn't go away? Day after day, same spot, same nagging feeling, and thought it's probably nothing? What if your body was trying to tell you something far more serious? For millions of Americans over 65, that quiet little itch might not just be dry skin or irritation from a new soap. Sometimes it's your body whispering a warning, long before louder symptoms like pain or fatigue ever show up. In this video, we're diving into 5 very specific spots on the body where persistent, unexplained itching could be more than just a nuisance. These areas, as seen repeatedly in medical case studies and real patient stories, have been quietly linked to certain types of cancer, such as lymphoma, pancreatic cancer, leukemia, and even inflammatory breast cancer. The science behind it? When something goes wrong inside, our immune or nervous systems often react early, through signals on the skin. But don't panic. This isn't about fear, it's about awareness. Because the truth is, early signs of cancer often look and feel completely ordinary, and they're easy to miss, especially as we age. So if you or someone you care about has been dealing with an itch that lingers, even after creams, laundry changes, or switching shampoos, this is the video you need to watch all the way through. We're going to break down what each itchy area means, what kind of cancers they've been linked to, and most importantly, how to know when to bring it up with your doctor. Let's begin with the first area you should never ignore, your lower legs. 1. Persistent itching on the lower legs, a signal you shouldn't brush off. Let's talk about an itch that many people, especially older adults, tend to overlook. That nagging, stubborn itch on the lower legs, particularly around the shins and calves. You may think it's just dry skin or a reaction to a new laundry detergent, but if the itch hangs around for weeks with no visible rash and doesn't get better with lotion, it's time to take a closer look. Here's why. Persistent itching in this area has been quietly associated with certain blood-related cancers, especially lymphoma, including Hodgkin's lymphoma. This may sound surprising, but doctors and researchers have seen this pattern enough to take it seriously. You see, as lymphoma cells multiply, they can affect your immune system and release chemical signals called cytokines. These inflammatory compounds don't always cause pain or fever, but they often irritate nerve endings under the skin, especially in the lower extremities. The result? A deep, hard-to-scratch itch that feels like it's coming from within rather than the surface. Unlike dry skin, this type of itch doesn't respond to moisturizers. It often worsens at night, disrupting sleep. And the skin may look completely normal. No flaking, no bumps, no redness. Just an internal restlessness that refuses to go away. Let me share a story that illustrates this. At a health awareness seminar, a 75-year-old man named George mentioned that he'd been battling a strange itch on the front of his legs for nearly 6 months. At first, his doctor suspected eczema, or maybe even a soap allergy. But after basic treatments failed and routine blood work showed abnormal white blood cell counts, George underwent a CT scan. What they found were enlarged lymph nodes, leading to a lymphoma diagnosis. In George's case, the itch was the first warning sign. No pain, no fatigue, just an itch. Now, does this mean every itchy leg is cancer? Of course not. But here's the important distinction. If you're over 60 and you've had a persistent itch on your lower legs that doesn't respond to lotions, isn't explained by dry air, soap, bug bites, or circulation issues, pay attention, especially if it's paired with other subtle symptoms like night sweats, unexplained weight loss, or fatigue. What makes this so tricky is that aging skin naturally becomes drier and more sensitive. But this type of itch stands out because of its persistence, resistance to treatment, and that internal, almost burning feeling. If this sounds familiar to you or someone close to you, don't let it slide. Mention it to your doctor, ask for a blood panel. Be specific about the pattern. Your body may be trying to communicate in a quiet, subtle way, and catching that message early can make all the difference. Up next, we'll explore another surprising itchy spot, the upper back, and why that phantom itch between the shoulder blades may signal something going on deep inside. 2. That itch between your shoulder blades? It could be telling you more than you think. Now let's move to a spot that's easy to miss, but could be surprisingly important. That deep itch in the middle of your upper back, right between the shoulder blades. At first glance, it seems innocent. Maybe you think it's from sleeping in the wrong position, a tag rubbing against your shirt, or just aging skin in a hard-to-reach area. But here's something many people don't realize. This particular spot has been linked to pancreatic issues, including early-stage pancreatic cancer, especially in older adults. You might be asking, how in the world could your pancreas, tucked deep inside your abdomen, cause itching way up on your back? Here's the fascinating connection. As tumors in the pancreas begin to grow, they can block the bile ducts, which are small passageways that carry bile from your liver to your intestines. When these ducts are obstructed, bile builds up in your bloodstream. This excess bile doesn't just stay quiet, it can irritate nerve endings, and the itching often shows up in nerve-dense zones like the upper back. This kind of itch is not like a normal, dry skin itch. It often feels deep, internal, almost like it's under the skin, and no amount of scratching seems to reach it. It tends to come and go at first, but may grow more persistent over time. Creams don't help. Lotions don't soothe. It just keeps returning. Quiet, stubborn, and easy to ignore. I once heard the story of a woman in her 70s named Linda who described this sensation perfectly. She called it her phantom itch. No visible rash, no redness. Just a maddening feeling between her shoulder blades, especially at night. After routine blood work came back with slightly elevated liver enzymes, doctors ordered imaging, and that's when they discovered a small tumor pressing on her bile duct. The itch was the only real sign her body had given her. Now, this doesn't mean every back itch is something dire, but if you've been feeling a focused, unrelenting itch in that same spot, especially if it's been going on for weeks or months, it's worth paying attention. And if it's accompanied by unusual fatigue, darker colored urine, pale stools, or unexplained weight changes, then it's time to have a conversation with your doctor. This part of your back may be hard to reach, but it could be sending a message that's deeply important. In many cases, it's not about reacting with fear, it's about responding with awareness. The earlier something is found, the better your options, and the better your peace of mind. Coming up next, what an itchy scalp without dandruff could be telling you. 3. Itchy scalp without dandruff? Here's what it might really mean. Now let's move to an area that most of us don't pay too much attention to until it starts driving us crazy: the scalp. An itchy scalp is usually chalked up to something simple: dry winter air, a shampoo that didn't quite agree with your skin, or maybe just aging. But when the itch keeps coming back, even though you don't see any flakes, redness, or signs of dandruff, it might be a signal worth listening to, especially for people over the age of 65. In some cases, this type of persistent scalp itching, especially when it's hard to pinpoint, moves around, or feels like tingling or burning, can be associated with deeper health issues. One condition that doctors have noted is leukemia, a blood-related cancer that disrupts how your immune system functions. Another possibility, skin cancers of the scalp, particularly in areas where the hair is thinning or sun damage has built up over the years. You might ask, why the scalp? Well, your scalp contains an incredible network of nerve endings and tiny blood vessels. When cancerous changes start to develop, whether in the blood or skin, your immune system reacts. In conditions like leukemia, white blood cells may multiply abnormally, leading to a cascade of immune signals that irritate the skin. This irritation isn't always visible, but it can trigger that maddening, persistent itch. Here's something else to consider. This kind of itch doesn't respond to typical remedies. Anti-dandruff shampoos? No effect. Moisturizing oils? Still itching. Switching hair products? Nothing changes. What sets this apart is how disconnected the sensation feels from anything external. There's a story that illustrates this well. A man in his early 70s named Henry began noticing an odd sensation on his scalp every afternoon. He thought it might be his favorite baseball cap, or maybe just dryness. But when it persisted and no treatment worked, he mentioned it to his doctor. Routine blood work revealed elevated white blood cell counts, and further testing led to a diagnosis of early-stage chronic lymphocytic leukemia. The scalp itching was the first and only symptom. And while leukemia is one possibility, skin cancers, like squamous cell or basal cell carcinoma, can also begin on the scalp, often as a tiny bump or patch that itches constantly before it becomes visible. In people with thinning hair, these early warning signs are even more important. So what should you do if your scalp is itching without a clear cause? First, rule out the basics: dry air, hair dye, shampoo, or hats. But if nothing helps, and especially if the itch feels deep or electrical, mention it to your healthcare provider. Ask someone you trust, like a spouse or hairdresser, to help inspect your scalp under good light. Because even something as small as an itch, if persistent and unexplained, can sometimes reveal something much bigger. And catching it early makes all the difference. Up next, we'll look at why persistent itching near the chest or breast area can be another warning sign that deserves your attention. 4. Itching around the chest or breast area, a sign that's easy to overlook. If you've ever experienced a strange, persistent itch around your chest or near the breast area, it's easy to explain it away. Maybe your shirt was too snug, your bra was rubbing, or the fabric just didn't breathe well. And in most cases, that may be true. But when the itch becomes repetitive, focused, and stubbornly unresponsive to moisturizers or fabric changes, it could be signaling something more than skin deep, particularly in older adults. One condition that experts have observed in relation to this symptom is inflammatory breast cancer, IBC, a rare but aggressive form of cancer. Unlike traditional breast cancer, which often forms a noticeable lump, IBC can begin without any visible mass. Instead, it tends to show up as a change in skin texture, warmth, or persistent irritation. In some cases, itching is the very first symptom. So why does this happen? As cancer cells form near the skin or lymphatic tissue of the breast, they can cause inflammation and blockages in lymph flow. This can lead to subtle skin changes, thickening, tightness, or warmth. In women, the area under the breast or near the nipple may start to feel itchy and uncomfortable. For men, it can be even more difficult to notice, since male breast cancer, although rare, often goes unrecognized in its early stages. There's also the possibility that nearby lymph nodes, such as those under the armpit or just beneath the collarbone, are involved. These can swell and cause nerve sensitivity in the chest region, again presenting as itchiness before other symptoms appear. A woman named Ruth in her late 60s shared a story that might resonate with many. She noticed an odd itch beneath her right breast that wouldn't go away. No rash, no bumps, just that same nagging sensation day after day. After trying different bras, detergents, and even going bryless, she finally mentioned it during her checkup. The doctor noticed subtle skin dimpling and ordered a scan, which revealed an early-stage tumor close to the surface. That decision to speak up about an itch changed her life. Now let's be clear, not every chest itch is cancer, but the key things to watch for are location, persistence, and lack of response to normal skin treatments. If the itch is always in the same spot, and especially if it comes with skin changes, like redness, thickening, or a sense of heaviness, it's worth discussing with your doctor. Don't wait for a lump to appear. Your body doesn't always follow the textbook. Sometimes it nudges you with small, persistent warnings like an itch, something that's easy to ignore but powerful if noticed in time. In the next section, we'll explore one of the most sensitive and most commonly ignored warning signs of all: persistent itching in the anal or genital area, and why speaking up could save your life. 5. Persistent itching in the anal or genital area. A taboo symptom that deserves attention. Let's face it, talking about itching in the anal or genital area makes most people uncomfortable. It's personal, it's private, and for many older adults, it's something they'd rather not even mention to their doctor. But here's the hard truth. Ignoring it could be risky. Persistent, unexplained itching in this region, especially when it lasts for weeks or months without relief, has been associated in some cases with early-stage cancers, including anal, vulvar, and even penile cancer. While these conditions are less common, they are more likely to appear in individuals over 60, and one of their first signs isn't a lump or a sore, but a chronic itch that won't go away. So what sets this kind of itch apart? It often feels deeper than surface-level irritation, and it doesn't respond to typical treatments. Moisturizers, anti-itch creams, or switching to fragrance-free soaps might provide temporary relief, but the itching always returns, sometimes worse at night or after physical activity. For some, the area may feel raw, sensitive, or slightly burning. Still, there's no visible rash, no injury, and nothing that seems out of place. One of the biggest problems? Embarrassment. Many people, especially men, may assume it's just hemorrhoids, poor hygiene, or friction from sitting too long. Women might chalk it up to postmenopausal dryness or irritation from incontinence pads. But if the itch is persistent, localized, and keeps coming back, it could signal something much more serious brewing below the surface. Take the story of Eugene, 76. He spent nearly a year treating what he thought was minor hemorrhoid discomfort. Creams, wipes, dietary fiber, nothing worked. Eventually, his doctor referred him to a colorectal specialist. A scope exam revealed a small lesion on his anal canal wall. It turned out to be early-stage anal cancer. The only clue? That nagging itch. Similarly, vulvar cancer, though rare, is more common in postmenopausal women. One of its earliest symptoms is an itch that feels different, more persistent, more irritating, and more focused than typical dryness. In both men and women, changes in skin texture, discoloration, or the sensation of thinning skin are additional red flags. So here's the takeaway. If something doesn't feel right down there, don't let discomfort, embarrassment, or fear hold you back. This region of the body is rich in nerve endings, which means it's often where early signs of deeper problems first show up. If the itch isn't improving, or if you notice subtle swelling, discoloration, or a change in sensation, see your doctor. You're not overreacting. You're being proactive. Remember, catching something early doesn't require fancy technology. It just requires listening to your body and having the courage to speak up, even when the topic feels awkward. Coming up, we'll bring everything together with a final message that could make all the difference for your health and peace of mind. As we wrap up this important conversation, let's take a moment to reflect. Each of the 5 itchy spots we discussed today, the lower legs, upper back, scalp, chest, and genital region, may seem minor at first. They're easy to explain away, easy to ignore. But as we've seen, these aren't just random irritations. For some, they've been the body's very first attempt to say something's wrong. And that's the key message here. Your body speaks in whispers before it ever starts to shout. Especially as we grow older, our symptoms may become quieter, more subtle. But they're no less important. This isn't about living in fear. It's about living with awareness, about recognizing patterns that don't feel quite right, about knowing when something persistent, unusual, or unexplained deserves more than just another lotion or shampoo change. So here's what you can do. If you've been dealing with an itch that doesn't go away, no rash, no bug bites, no improvement, despite trying everything, it's time to bring it up with your doctor. Even if it feels like a small thing, early detection starts with small things. And if you found this video helpful, please consider liking it, subscribing, and sharing it with someone you care about. You never know who might need this information. Leave a comment below and let us know. Have you ever ignored a symptom that turned out to be something serious? Your voice matters and your attention to your own body? That might just be what saves your life or someone else's.